What is clinical massage and when is it right for you? Here to talk about that is Shonda Henry with Tulsa Spine and Rehab. Shonda, first, let's define clinical massage. What is it and what is it not?
Well, to me, clinical massage is when the massage therapist works alongside the doctor or the physical therapist, and there's a specific issue or injury that the patient has, and doctor will say, let's work on this and this, and so we are doing specific things that the doctor is directing us for that patient.
So you're getting in and really working a specific muscle group or that sort of thing at the direction of the doctor.
Yes.
It's not a pleasurable necessarily massage like we might think at the spa. It's not like that at all, correct?
Yeah, especially when, like some of the patients that we get, whiplash or, whatever injury, they're hurting. And so we try to make it as comfortable and, sometimes we have to go pretty slow with the massage movements to enable them to relax with the movement that we're doing.
So you mentioned whiplash. What are some other conditions that benefit well from massage, clinical massage therapy?
Oh my goodness. We get a lot of athletes, runners, little kids with concussions from, football or whatever. I mean, there are so many different areas. It's hard to say what it's not good for. Back injuries, shoulder, rotator cuff, just so many areas.
And so when someone comes in for a session with you, is it just like a 30-minute session where they get a pretty good workover, or sort of describe a typical session?
Well, there again, it's directed by the doctor. Sometimes it's only 15 minutes, and then they do other therapies with that patient. Yes, sometimes we'll do a 30-minute, but also the patient can say, I need extra time, and then pay for that time because the insurances will pay for certain parts of that. And but if they want additional time, they can request that and just pay that additional time.
And so they'll come in and you'll just start really going to work on whatever the problem area is,
Yes.
Trying to work out kinks and things of that
Yes.
nature. And how long, and again, it probably isn't, it just depends on the situation, but a treatment plan could probably go on for many, many months. Is that right?
That's really individual. It depends on the severity of what's going on, and some patients heal really quickly. So that's hard to say.
Yeah, it just depends on the situation.
Yeah.
And if someone comes in for a session, if they have a session scheduled where they're going to come and get some clinical massage, what's a good way to prepare? What's some clothing that might be good for that, or maybe they've never done it before? How should they get ready to be a good patient for you?
Well, and there again, it depends on what the therapist and the doctor are doing here with them. We have a whole workout room for when the patient is in kind of that rehab end of their the recovery, then they'll wear tennis shoes or workout clothes kind of thing. But so we have people coming from work, and so they're in suit and tie, or and then they bring their workout clothes with them. So it's really what works best for you. If you're coming from work, just bring your stuff with you. But we work on people fully clothed, and we work on people partially, but they're covered with a sheet or towel. So that's a different way. I mean, there's kind of all different ways that we do things. It's really geared toward that individual patient.
The professionals at Tulsa Spine and Rehab have the training and expertise to address your aches and pain. You don't have to live with pain any longer. Give them a call today at 918-743-3737.